Let's now look at patient activation. Patient activation refers to a patient's knowledge, skills, ability, and willingness to manage his or her own health and care. Patient engagement is a broader concept that combines patient activation with interventions designed to increase activation and promote behavior change. A growing body of evidence indicates that patients who are more actively involved in their health care have better health outcomes, incur lower health care costs, and have better health care experiences. Patient activation can now be measured using the Patient Activation Measure. The measure is scored on a 0 to 100 point scale, and people are categorized into one of 4 activation levels, with level 1 being the least activated and level 4 being the most activated. The score incorporates responses to 13 statements about beliefs, confidence in managing health-related tasks, and self-assessments of knowledge. The patient activation measure has been shown to be reliable and valid across different languages, cultures, demographic groups, and health statuses. Here we see the 4 levels of activation. First, patients have to believe that having an active role in their health is important. Next, they have to have the confidence and knowledge to act effectively. As they start to gain confidence in their ability to take on self-management behaviors and make lifestyle changes, patients will begin to take action. At the highest level, patients will stay the course even when they encounter new situations or when they are stressed. The patient activation measure can be used in many ways. It can be used to identify patients who need more support, guide care, tailor patient support, assess interventions designed to increase patient activation, track patient progress as a self-manager, stratify a population, and allocate resources. Now let's look at communication. To be effective, patients have to be able to understand the treatments and recommendations that are being given to them. It's also important to recognize that some patients know they have to change their behaviors, but may need help in doing so. Just because we think we're communicating clearly doesn't mean that we are. Communicating clearly means that we are using plain, non-medical language, limiting information to what the patient needs to do and know, using visual aids such as pictures, diagrams, or models, and using easy-to-read print materials. The teach-back method can also be used to see how well patients understand the information that is being communicated to them. In the teach-back method, you first provide some information to a patient and then ask them to explain it back to you in their own words. If they can explain it back to you, then they understand. If they can't, then you have to try to clarify and then reassess their understanding. It's also important to encourage patients to be involved in the conversations during visits and to be proactive in their health care. Body language can play a big role in whether a patient feels comfortable asking questions. For example, sitting at the same level as the patient and not appearing rushed are simple things that you can do to encourage questions. We can also solicit questions from patients, but in doing so, you want to use open-ended questions rather than yes-no questions. For example, you can say, "That was a lot of information. What do I need to go over again?" rather than, "Do you have any questions?" This study that examined whether a simple waiting room intervention to help patients ask questions could increase patient activation in an underserved population. The program focused on teaching patients how to generate questions regarding their healthcare concerns and treatments, and then prioritize those questions. In doing so, patients would be better able to advocate for themselves and participate more fully in the decision-making process. This study was conducted in 5 community health centers in New York City. A total of 252 patients participated in the study. They were predominantly Latino or African American. The intervention was associated with a significant increase in patient activation scores, with 1/3 of participants moving from a lower level of activation to a higher level of activation. Interestingly, patients who initially stated that they preferred a more passive role in their interactions with physicians had greater increases in their post-intervention activation scores than did those who initially preferred a more active role. Individuals spend almost all of their time outside of the healthcare system, and as such, they manage most of their health concerns outside of the healthcare system. As you can see, numerous strategies can now be used to better engage individuals in their health and healthcare within the context of their lives. Patient portals, health coaches, email, health applications, and gaming are just a few of the strategies that can be used to engage individuals in their health, the healthcare system, and the context of their lives. A 2014 publication using data from the National Ambulatory Medical Care Survey found that while the adoption of electronic health records continues to grow in the United States, health information exchange and the use of computerized capabilities to engage patients remains low in office-based settings. 57% of office-based physicians provide patients with a clinical summary of each visit. 47% electronically provide patient-specific educational resources. 30% routinely exchange secure messages with patients, and only 24% routinely provide patients with the ability to view, download, or transmit their health record online. A report published in 2014 gives us some information on the use of patient portals. A large portion of veterans seek care outside of the Department of Veterans Affairs, VA system, making information sharing and care coordination especially critical for these individuals. In 2010, the VA launched the Blue Button tool to help veterans access and exchange their personal health data in a standard, consistent manner. In this study, researchers surveyed users of the VA's patient portal over a 2-month period in 2012 to examine the adoption and use rates of the Blue Button feature. Of the 18,398 survey respondents, just 33% were Blue Button users. Interestingly, 61% of the non-users said they were not even aware of the Blue Button. Among Blue Button users, 73% said the greatest benefit of the tool was having all of their medical records in one place, giving them a better understanding of their medical history. 20% shared their data with a non-VA provider. Of those, 87% reported that the information was somewhat or very helpful to their external provider. And 75% gave the Blue Button a rating of 7 or higher on a 10-point scale, with 1 being not at all satisfied to 10 being extremely satisfied. Engagement in care coordination programs can be challenging. One study examined why individuals insured by an American Association of Retired Persons, AARP, Medicare Supplement Insurance Plan chose to engage, disengage, or not engage in a care coordination program. Results from surveys and focus groups suggested that the best communication medium appears to be a telephone call from the assigned program nurse. Individuals should be informed that the program is available at no additional cost, which should be emphasized early, convenient, led by a dedicated nurse, and enhances the personalization of care. The study found that individuals are less likely to engage or more likely to disengage if they are unsure what to expect from the program. They suggested that programs have an official name and recommended that words such as health or care should be used when describing the program. They also said that mailings had little effect on engagement decision.